and I'm the volunteer coordinator with Pacific Point Healthcare Services, specifically with our hospice team. And I'm so happy that you're here to learn about hospice. And it was really created to bring hope and comfort to people at the end of their lives. But before it was adopted by formal medical services, it was run by volunteers, offering emotional and social and spiritual comfort to patients in need. And over 50 years later, hospice volunteers still play such a vital role in end of life care. And through their actions, although they seem small, they have an enormous impact with just bringing joy and really solace to people during a very complex moment of their life. Another person joining us here. Hi, I'm just going over some introductory things. I'm Megan, I'm the hospice volunteer coordinator. And I'm happy that you're here to learn more about hospice and what it means to become a volunteer. So today, I'm going to talk a little bit about hospice philosophy. We'll talk about what it is and really what it isn't. I'm also going to go over how our team at Pacific Point comes together to provide care. And then specifically, I'll get into the volunteer program, why we have a volunteer program, what are the different opportunities, and I'll tell you a little bit more about how to apply and really the process of becoming a hospice volunteer. And of course, at the end, there will be a question and answer. You can ask me questions in the chat, and really throughout the presentation, you're welcome to throw questions in the chat, and I'll address them at the end. So what is hospice? Well, hospice is not actually a place, but it's more of a philosophy, and it can be provided wherever home is for the patient at that time, such as their private residence, assisted living community, or a skilled nursing facility. And if the patient is required to move to a different level of care, the care of the hospice team will travel with them. And hospice services are available to patients regardless of age, religion, race, illness, or the ability to pay. And really, it's the most robust form of palliative care. Unlike palliative care, which can be provided along with more curative treatments and may begin at the time of a medical diagnosis, hospice is not focused on curative treatment. It's an approach to care that is reserved for patients at the end of life that is really focused on providing comfort and family support after curative treatment efforts are no longer being explored. And this is a very holistic approach to care. It addresses physical needs such as pain management, but also the emotional, spiritual, and social needs of not only the patient, but their family and supportive network as well. So, despite its many advantages, hospice is riddled with myths and misconceptions that contribute to its widespread misuse. And arguably, the most common idea is that hospice care is appropriate only in the last days of life, which is not the case. The palliative care offered through hospice doesn't focus on the halting or delaying or curing of an illness, but rather on comfort, like I mentioned. And on the flip side, it doesn't hasten death at all. And that's a very common misconception with it. Really, at the center of hospice care is the core belief that each of us has the right to die pain-free and with dignity, and that when you are at the end of life stages, you're still living and you deserve that quality of life. So our team, especially with volunteers, work to provide that care and make sure patients feel that they have autonomy in their care and that they still are receiving their quality of life. We had some new people coming in. Hello. As a quick introduction, I'm the volunteer coordinator, Megan, and I'm going over really just hospice. And right now I've just gone over what hospice is not, but really it's focusing on the whole person, their emotional needs, their physical needs, and spiritual needs. And I'm going to get into how we do that right now through the interdisciplinary team. So it's really unique in that it's provided by a more collaborative team of professionals, and each team member provides a really interesting perspective and expertise through their individual profession. And so this team consists of the patient's personal physician, a hospice medical director, nurses, certified nursing assistants, a social worker, spiritual care provider or chaplain, a trained volunteer, as well as the volunteer coordinator, and a pharmacist, dietitian, and any other physical therapy or occupational or speech therapy that is needed. And this team-oriented approach allows us to see the patient and their loved ones as well in a more broad lens. And they're not their disease, they're an individual, and they have all of these complex needs and desires that we're working with. And we want to make sure that we're coming together and providing that care as a team. And really, that's where volunteers are such a vital portion of that too. And I'm going to mention this later, but it's interesting because volunteers have the opportunity to sit with a patient or notice and observe things about a patient's care or condition that the other parts of the team might not observe or might not have time to observe. If the nurse is coming in and just, providing medication or wound care or things like that, they might not be able to have the time to sit with a patient and say, so how are things going? Tell me about your experience. And that's where a volunteer can really fill in the gap and help the team come together. So here at specifically Pacific Point, our mission is to provide that home-based care with compassion and respect for each of our patients and their support network. And as a team, we really take the time and care to put in a lot of effort into our care and take it very seriously. And as a volunteer, you're an extension of that team. And so we expect that you would represent the values of Pacific Point as well. So why does hospice have a volunteer program anyway? Well, it's part of the Medicare benefit of hospice, that providing of holistic care and giving patients the option of physical care and emotional care and spiritual care. And the volunteer program is unique in that it's the only Medicare program that utilizes and requires the use of volunteers. So under federal law, hospice agencies are required to have 5% of their total patient care hours be dedicated to volunteer work. So for example, in a year, all the hospice nursing visits, the chaplain visits, the social work visits, home health aide visits, all of those could equal 100 hours. So it's required that that agency have 5 hours of volunteer work as well. And regardless of what volunteers do, showing up and spending time is really what matters. And they, like I mentioned, are a vital part of the team and work with the professionals on the team to provide that extra insight into the patient's condition. And they're really that extra set of eyes and ears to observe changes or needs in the patient and the family, and getting that across to social workers or our chaplain or nurses. And also, even though families visit as often as they can, or even the family members are the caretakers themselves, hospice can be very lonely. And because of their illness, a patient's world tends to shrink until it really revolves mostly around those nurses and doctors and medical procedures. So volunteers are a chance for them to really reconnect with their community and make new friends and be social and also have their voice heard. It can be a time where if they feel they don't want to burden their family members or complain to them, volunteers are a good neutral person that they can express those frustrations or confusion about. So yeah, that's in general the volunteer program. But I wanted to talk too about the different types of volunteer services, the different types of things a volunteer can do, because really there's so many, and I'm just going to touch on kind of a few, but this is why hospice volunteers are indispensable to the functioning of our organization and really the quality of care that we provide. They work directly with patients, but also behind the scenes and help our organization run smoothly. So hospice volunteers might find the idea of working with patients intimidating at first, but it's incredibly rewarding. And it's also up to the volunteer of how they want to interact. Like if they are very passionate about gardening, or if they love playing music, then they can incorporate that into their visits. Some volunteers go and they play their instruments for patients and family members. They garden, they do cooking. Some also work on legacy projects, which is really documenting a person's life story. So having somebody who's really passionate about writing or wanting to hear somebody's life story and write that down for them and create a book, that can be really powerful for both the patient but also the volunteer as well. And they could chat, they could play games, even just I wrote that down of sitting quietly and just being present. It might not be possible to have a deep interaction with a patient that, let's say, is just nonverbal or is very quiet. Being a comforting presence is in and of itself so nice and has tremendous value. So really there's all different avenues in terms of different types of patient care that volunteers can do. And in addition to that, having volunteers work behind the scenes to provide support for our office staff, which they can conduct patient care surveys or do data entry. We have volunteers assemble patient admission materials and work with our HR team to either just update things in our filing system or really help our nurses with stocking equipment, all sorts of things in our office. So there are a lot of different ways that they can get involved. And like I mentioned, it really depends on the volunteers' skills and interests and where they feel they'd be the best fit for a patient as well. So there are a few requirements for becoming a hospice volunteer. You must be 18 years old, also having a reliable mode of transportation and a valid driver's license. And all volunteers complete a background check, but for those volunteers who are providing direct patient support and family support, you also additionally have a TB test, a physical, and a drug screening. And all of these are at no cost to you. We have a urgent care center that we would send you to complete these as well. Also, as a volunteer, regardless if you're in the office or if you are out seeing patients, you must adhere to all of Pacific Point's policies, such as being in compliance with HIPAA, which is the Health Insurance Portability and Accountability Act. And this is the law that gives patients the right to their medical information, meaning it's very important that all of our team members, including our volunteers, do not share private medical information about any patient with any of their friends or family. So things like that, it's very important that our volunteers understand that this is their private information. And while you can share, details about your visits, about what you did or the music that you played, just not sharing that private information. Also, we do ask that volunteers commit a minimum of 2 hours of service a month, but of course this can be more. And in addition to all of these, I'm really looking for prospective volunteers that are caring and compassionate and patient and approach life as well as approach these difficult topics like death and dying with really an open mind and a genuine curiosity about people's experience and willingness to support others through a very complex and sometimes tumultuous time. So, what is the process of becoming a hospice volunteer, for example? Well, the first one is submitting an online application. I actually have the QR code in the corner there for our application. And I'll also, in a minute, put the link of our application in the chat as well. But once I receive an application, then there's an interview with me. And really in this interview, it's basically to gauge where you're at with volunteering, if this is a good fit, and this is the type of work that you can do. Even if you have no hospice experience or nursing experience or any previous knowledge, that's totally fine. It's mainly to see if you're willing to learn, and also if I see you as that compassionate person that's willing to sit with people and be present with people, and provide just that caring presence, really. And next would really be the onboarding process with our agency. That's when the background check comes in, the testing, and there's a short orientation as well. And then you move on to training. For volunteers working in the office, our administrative volunteers, there is less training and it's more just orienting you to hospice and office work as well. But as a volunteer who's going to go out into the field and provide that direct patient care and family support, there's training that goes more in depth into the signs and symptoms of death. We talk about how to support patients with cognitive decline. We also talk about communication skills and really grief specific communication skills and styles, and also how to establish healthy boundaries in this type of volunteering, because it can be very heavy, it can feel very personal. So having that training on how to separate yourself and to make sure that you are taking care of yourself as well is very important. So those are a combination of online trainings and also in potentially in-person trainings if that is what you're into. I have the ability to have them basically all through video as well, so it doesn't have to be in person if that's not convenient for you. But once you go through training and you've completed that, then it's my job to match you with a patient based on your availability, your location, and your willingness to travel, and your interests, and also the patient's needs and interests, and their location and availability as well. So once I create a match, then it's about making that initial visit, those initial introductions with the volunteer, myself, and the patient and family to see if it's a good fit. And then if everything's good and it feels like a solid connection can grow from there, then you're sort of off and running and you're ready to do your own routine visits with patients, which is very exciting. But yeah, that's basically the general process. And of course, my job also is to make sure that I'm with you every step of the way. I would never send you into a volunteering situation that you do not feel comfortable with. I also am very thorough with training and making sure that everybody feels confident and comfortable to go into a situation with the patient. And so, yeah, I would never throw anybody into the wolf pit basically and just fend for themselves. But that's basically the main process. Let me throw the application link in the chat before I forget. This. Here we go. And yeah, that's really all I have for my presentation for the hospice volunteering. Feel free, since it's just a few of us, feel free to unmute yourself to ask questions, or you're welcome to ask them in the chat. That's totally fine. And also, I know some people arrived a little bit later while I was sort of getting going into my presentation. So if you have any other questions about hospice in general, then I'm happy to answer them as well. And if not, that's totally fine too. Oh, I see Katie's hand raised. If you want to unmute yourself, you're definitely welcome to, or you can throw it in the chat as well. Oh, strange. Not allowing. I'll allow Mike for all this. Okay. I'll allow both of these as well.
Hi there, Megan. My name's
Hi.
Katie. Thank you for that, all the information. My question is, if I'm only able to volunteer, say, 5 hours a month, if I matched or you match us with patients, how does that work? Because is there going to be multiple people matched to that one person? I'm just curious because in the past, it's hospice when I've been there for it with grandparents or friends. It's been like a week of hospice there, and so I'm just curious on how that works and pans out with volunteering if you're matched with a patient and then you're only able to do, like I said, like two or 3 hours that one week, and then they're only there for that week. You know what I mean?
I see. Yeah, yeah. So it really varies. So basically for our agency, I'm kind of going to answer your question in a couple different parts. So our agency has patients who have been on services potentially for months, for weeks, and then also for days. So it really varies. And because volunteer services are optional, it's really part of my job to even assess if a patient coming onto services wants a volunteer. And then if they do, having to figure out what kind of things they would want. So, for example, if we have a patient who is admitted, it's likely that they'll be on services for a month, or maybe a couple months. And because it's also very hard to tell. Some people are become very stable in their condition and then some decline very quickly. But if in general we understand that it could be about a month and they do want volunteer services, and let's say they want someone to come and read to them once a week, then it would be my job to go into my volunteer database and find volunteers who are in their location, who are willing to um, read, or that's something that they're wanting to do, and then matching them so that they can come and do, let's say, an hour visit once a week. And once that's sort of established, then it's really dependent on the patient and their condition. So if they're still every week wanting someone to come in, then they will. And as their situation changes, or if the patient starts to decline and no longer wants volunteer services, then I would be in communication with the volunteer and saying, actually, they no longer want services. I can transfer you to a different assignment. So basically, it's one volunteer per one patient. And I call them assignments because it's also optional for the volunteer. I present assignments to the volunteers. I say, this patient is in your area. They're looking for once a week or even once a month for an hour. And they can either say yes. So a volunteer can have multiple patients that they see, but it's really having a patient having one volunteer. And if the situation changes or if they no longer want services, then telling the patient that, okay, they're declining services or they no longer, and not to take it personally at all, but just you'll no longer be seeing them, but I can offer you these new assignments, if that makes sense.
Yes, it totally does. Thank you so much.
Yeah, of course.
Megan, this is Yvonne. I have a question for you.
Yes, of course.
The volunteer hours, are they Monday through Friday, 9 to 5, evenings, weekends, early morning, that kind of thing?
So short answer is yes. There are a lot of different opportunities. I've noticed for the requests that we get from patients, it's usually during the week. So Monday through Friday, and it could be mornings, afternoons, evenings. I have had cases where a volunteer or where a patient has requested to watch football games with them on the weekends. And that is, for a finite amount of time on the weekends. But in general, I've seen it mainly be during the week. I think that's because when we have our social worker and our chaplain and nurses also doing routine visits during the week, I think they like having that structure with a volunteer as well during those times. And but again, it's really flexible. If you say, actually, I'm looking for opportunities or I'm looking for assignments that are mostly on the weekend, or let's say I can really only do Thursday, Friday in the afternoon and evening, then that's my job to really be specific in my matching and make sure that not only the patient is their needs are being met, but also the volunteers' needs are being met.
Perfect. Thank you.
Yeah. there any other questions?
Megan, just one more question. From start to finish, where we go on, we submit the application online and then the interview, and we go through all the steps. What is the time frame for that usually? A couple weeks, a month?
I would say from start, depending on if you decide to do administrative volunteering or that direct patient care involving that extra training, I would say a month. I'm very quick about scheduling interviews right away and getting onboarding going really quickly too, just to make sure that it's not delayed and that you can really get going with your volunteering and people, really want to get started with spending time with patients. So yeah, I would say from start to finish, it's a month. But that can also change if people go out of town, that's totally fine. Or if people say, actually, I want to pause this training a little bit and then come back to it, that's also fine. It's very flexible.
Great, thank you.
And
yeah, thank you so much for all of your questions. I appreciate it. I know it's kind of, oh, you're welcome. Oh, yay, I'm excited for you to apply too. It's really rewarding for me to see volunteers and patients have those quality interactions. Even just this past week, I was visiting a patient and they were raving about their volunteer. They just were like, why are you here? Why isn't Mike here? Like, I don't understand why he can't just come and hang out with me. But yeah, it just is the testament to how those bonds form so quickly and how they just really appreciate it. And it's really delightful to see. So yeah, I'm excited for people to apply and also for you to just be here to learn about hospice. It can be sort of a weird topic or a hard topic. So yeah, I'm excited. But if nobody else has any more questions, you're free to go off. I'm going to stick around in case anybody does decide to either ask questions or pop in. But yeah, you're welcome. I appreciate you being here. You're welcome. Thanks, Yvonne.
Bye, Megan.
Bye. Have a good one.